All right, hi everybody, Dr. Nikita Vizniak, and today I'm going to walk you through foundational information for all of the treatments that we're offering for any client or patient, evidence-informed best practices for musculoskeletal pain, but it doesn't just have to be limited to pain. The first thing that you're going to be doing, you've seen me promote this over the last 20 years. This is probably the most important drawing that I've done in the last 20 years, actually, updated with current evidence-based practices. And we're going to see motivational person-centered interview. It is our job to make a connection with our patients and clients and make sure that we can understand what motivates them and how to get them to perform better tasks with an underlying theme of minimal effective dose. What is the least that I have to do to help you get better? One of the first things that I have to do in that interview, though, is rule out or rule in serious pathologies. You need to look for red flags of more serious pathology. Once those are ruled out, we can get onto the factors that motivate. If we progress to the next section, we can see it's assessing biopsychosocial fears, beliefs, and goals. And you would be amazed the results you get by asking someone, what are their fears and what are their beliefs? I can remember, and this is a crazy case, I'll just give a prime example of it right here. I had one bodybuilder come in and he believed that he had to not defecate, and this is crazy, not defecate for 5 days in order to get the maximum absorption of the food that he ate so that he could actually maintain the base mass. I know those of you who are watching me do this right now, they're like, what? That's crazy. It was causing all kinds of GI issues. And that's as crazy as it gets. Like there's even crazier beliefs than that out there that we've all seen. So check what your person's beliefs are. The other thing is looking at the fears. For a lot of people, we have psychology of pain that we talk about for most of our programs. I put that as my second most important drawing over the last 20 years. The psychology of chronic pain. A big thing that we really do as therapists is we are cheerleaders, getting our cinnamon bun hands out, this is the cinnamon bun shape right here, and giving people permission saying, yes you can. If you are watching this right now, if you just take your hands and lift them up and say, yes you can, you will feel better. There's research here out of Harvard University talking about power poses, decreasing fear-based thought processes in your own mind and increasing positive hormone levels. Now the next thing is, and it's changed the way I've practiced in the last 10 years at least, every patient, when they come in, I'm always asking, what are your goals for today's therapy? Some people are looking for active goals that are related to musculoskeletal disorders. Other people are looking for nutrition complements or supplementation that they can get into. Other people are just looking for a detailed assessment. How many patients do I see that come in that have seen X, Y, and Z other practitioners and like, I just want you to walk me through with the 20 plus books of knowledge that you have and give me an accurate diagnosis and maybe think of some better ideas for my treatment that I can go through because I've reached kind of a plateau or I've stalled out on my overall development here. The next thing you have to evaluate as part of this key assessment for biopsychosocial is going to be sleep. If your clientele is not sleeping well, they are not going to be performing well and they're not going to be feeling well. And it doesn't matter what the condition is. If it's depression, if it's a glenoid labral tear, if it's a meniscus tear, if it is digestive issues, they are not going to perform as well if they don't sleep as well. It is foundational to set up good sleep hygiene. And we talk about that. I mean, a few quick points if you want to go through it. Number one, regular routine, regular sleeping time. Cool room is going to help. Making sure that it's dark. That screen time should be not about half an hour to an hour before bed, no screen time, as well as no large meals. I always say no caffeine or cocaine before bed. Talking to some of you in the audience right here, all right? Okay, and the next thing is making sure that they follow that routine. So many people have their phones by their bed. Put it somewhere else so it's not by your bed. You can't grab it right away. Now, the next thing is going to be assessing mobility, strength, and neurologic function. And everybody thinks, well, I got to do a detailed neuro exam, and we're going to go with resistance with the Cybex machines and see what newtons of force you can generate. No. All you have to do to assess all of this is active range of motion. How many of you have clients and patients where the only time they do active range of motion is when they walk into your office? It's a baseline assessment of overall function. Can you squat and get back up? I don't care about the form to start with, especially if you're not lifting heavy weight. I just want to see, can you do the motion? Can you do 10, 15, 20 push-ups? Can you do a pull-up? These are tests of functional strength that actually matter in the research that are correlated with improved quality of life and life expectancy. The next thing that you're going to do is you're going to use outcome measures. How can you tell if this person's getting better? The most common ones are pain decrease, which we know there's actually multifactorial for reasons for pain decrease. Sleeping could be a major component of that, in fact, as well as many other factors like relationship status, what their friends told them, how much they fixate on this topic. We have other great graphics where we talk about different pain parameters and what influences pain overall. But you want to use outcome markers like range of motion. Activities of daily living are more important to patients. Athletic performance for athletes. I treat a number of pharmacists and other doctors as well, and one of the key things that we're always talking about is how do I decrease your medication intake? Now, for a lot of you, it'll be out of scope to make recommendations around medication intake, but you know what? If you were taking a Tylenol a day to deal with your headaches and now you're only taking one once a week, that decrease in medication is an outcome that is positive for the patient. Celebrate those small victories for them. The next thing that you need to be doing is giving people a written on paper education about their conditions or rehab or whatever they're going to be working on. That is the entire purpose of these books down here. The low back pain, head and neck pain, upper and lower limb pain books, they are designed to be educational. The research is abundantly clear. The brain prefers paper. You will learn it better if you see it on paper. And the back of these books, you can actually use it as a way to advertise your own clinic and what you do. Patients expect their doctors and therapists to be educated beyond them, and part of the way you can look more educated is physically just having books in your office and referring to those texts as a base of knowledge so it looks like it's more intelligent on your part. I can't stress that one enough. If I just send you an email, what happens? Like everybody else, it disappears. If you flip through your screen, you're gone as soon as you swipe left or swipe right. But paper sits in the environment. It advertises what you're doing. Someone is going to pick up, someone else even in their workplace or in their family is going to pick up that pamphlet or booklet, look at it, and it can inspire them. I cannot tell you, I've made millions of dollars over the last 10 years, 20 years, and helped millions of people, and the best way that I've known how to do that, we can reach through video, but ultimately is going to give you printed material that you refer back to on a regular basis. All right, next thing is going to be diagnostic imaging, and this is a big one. For a lot of patients, what they wind up believing is diagnostic imaging is 100% accurate. Absolutely, positively, it is not. There is research that supports if you just read a radiology report as a patient, your symptoms will be worse. Let me say that again. Your symptoms are worse if you read radiology reports. It's our job to minimize and state that these things are normal age-related changes. What was one quote that I saw from Dr. Huck's orthopedic surgeon recently? Telling a patient they have telling a 60-year-old they have a labral tear is like telling them they have a gray hair. Okay, that is exactly what it is. Super common. Many of these things are normal age-related changes. Just so you understand, if we did MRIs of the general population, we would see approximately 30, well, it depends on the research that you read, anywhere from 30 to 80% of the population has disc bulges, and they are asymptomatic. So you cannot use radiographic findings without clinical correlation to create differential diagnoses lists and tell the patient what's going on. There's another great expression I like called VOMIT, okay? Victim of medical imaging technology. Again, do not overemphasize the importance of radiology. If you look at OHIPNers, observation, history, inspection, palpation, neurovascular screen, motion, referred pain, and special tests are only useful if they're going to help you rule in or rule out a specific pathology. That's it, okay? If you're at a loss, then the special tests come out. But do not overvalue the opinion of radiographic images. The next thing is going to be, and where I was disappointed by one of our meta-analyses that we came from, that we pulled our information from, was nutritional assessment. I am going to suggest to you, especially in North America, where we have approximately a 70% obesity rate plus, that nutrition is foundational for all of our healing, nutrients, and how we actually get people better. And if you can just make small changes in most people's diets, you can see huge outcomes in their overall health and performance. One of the biggest culprits we all know is high dose refined carbohydrates causing systemic inflammation in the body. It makes everything feel worse. I can talk about it for myself. I can talk about it for my dad as an example. When he finds himself eating inflammatory foods, so high refined carbohydrates, a lot of processed meats, he says he notices the joints in his body start to ache more. He feels more inflamed. His skin is not as good. All of that makes a difference, okay? So nutrition is foundational. We have entire separate nutritional classes that you can go ahead and look at, done by some fantastic doctors that are going to be excellent for you to look at, and I would strongly encourage you to work with registered dietitians, naturopathic doctors, and other experts in nutrition to actually facilitate this entire process. Like I said, one of the systematic reviews where a lot of this information came from did not include nutrition. It boggles my mind that nutrition is not forefront for most of these processes. The next thing is going to be, and it's the same for all of our treatments and all of our therapies, you'll hear me quoted as saying, always progressing from least invasive to most invasive with a minimal effective dose. This is exactly what we're talking about here with a graded activity exposure that facilitates ADLs. So I'll say a couple of things here on this. Number one, you need to get people out walking. It's pretty simple. Every step that you take up until about 10,000 steps is drastically reducing your mortality rates. So getting people walking on a regular basis will drastically improve health. If you can get them walking in the forest, Japanese forest bathing in trees, there's great research there. We're working on a book right now on longevity. And part of that process is if you walk around trees and live in an environment with lots of trees, it can be the equivalent of an extra $10,000 a year in income for how good you feel, or approximately 5 to 7 years to your lifespan. Walking is a great exercise, and most people were just not doing it enough. So getting out walking, I always have to throw in there because I'm a big fan of it. Also, racket sports are going to be a big win as well. But it's graded activity exposure. You do not want to overload the person too much at the very start. You want to gradually see their skills develop. I have one badminton player that I've been coaching. She's been playing for just about a year now, and she would miss the birdie repetitively all the time, and now she's able to hit, and she's getting into some better games now as her skill set gets up, and you should see the smile on her face. Another example of this graded activity exposure, I can give a patient who came in yesterday, Pat. She has the early start of a little bit of dementia coming on, but it's okay. She's actually taking big steps to get this better, but she's lost a lot of mobility and had a few concussions from falls, about 84 years old, and she walks like this. Part of the activity that I gave her to do is I just took her and I said, let's dance. Let's flow a little bit. And that gait that didn't actually move very well, you could see that she was able to step and move with a little bit of support. But beyond that, and this entire process has to be facilitated by it, it was fun. She enjoyed the process. Her eyes just lit up. Her son and husband were here during the visit, and right away they knew that this was a winning option for her right here, so get that fun back into it. All right, so those are just a couple of ideas that I can throw out there. We talk about more of those in our courses and our seminars, always with the goal of evidence-informed best practices to give the best results for our people and clients. At the end of the day, your manual medicine techniques support all of this process. Little check-ins, if you look at motivational interviews, are ways to keep people up on the mark so they keep on trying a little bit more, a little bit more. That positive encouragement, one of the big things that I do for most of my clients is I am there celebrating their small victories. Helping you realize, you know what, you couldn't touch your toes before, now you can touch your toes. What, you couldn't pick up your grandkids, now you can pick up your grandkids? Those are big deals and you don't realize it. This morning at the gym, I observed one woman, she must have been in her 80s or early 90s, and she was stepping up onto a pull-up machine that was a weight-assisted version of it, and she had to get up there really slow, but I was there cheering her on, saying, fantastic, I'm so glad that you did that. And the manual therapies can help with that. Massage therapy to relax the muscles and give you more confidence in movement, increasing the range of motion, decreasing your pain. Joint mobilizations, acupuncture, pin and stretch, instrument-assisted technique, our smart therapies, all these things are designed to facilitate the entire rest of this process. So, in your practices, you should be doing a balance between biopsychosocial, evidence-informed best practices and integration of your manual therapies for the optimal outcomes. I hope you find this useful. You'll see it's a common theme through all 20 plus books that I have written. It's designed to help people get better faster, stay stronger longer, and live happier, healthier lives. Thank you very much, and we'll see you in the next section, a seminar, a book, somewhere else in the future. I love what I'm doing. I hope you love it as much as I do, and bring this information to the masses so we can all help as many people as we need get better. Fantastic.